Hello and welcome to another episode of Iranian Surgery Podcast. Today we are going to talk about liposuction procedure, what liposuction is, how it gets done, and its recovery. First of all, we are going to talk about what liposuction is. What is liposuction? Liposuction, also known as lipoplasty or lipo, is a surgical procedure that uses a suction technique to remove fat from specific areas of the body, such as the abdomen, hips, thighs, buttocks, arms, or neck. Liposuction also shapes or contours these areas. In fact, liposuction is a surgical procedure which removes the exercise and diet-resistant stubborn fat from a person's body and enhances its aesthetic appeal. The doctor puts a small, thin tube through very small cuts in the skin. Then the doctor moves the tube around under your skin to reach areas with more fat. Liposuction is often combined with other procedures to create a desired shape and is one of the safest and most popular cosmetic procedures. But nowadays, many ask about when to consider liposuction. Well, you may consider liposuction if you have localized areas of fat deposits that are disproportionate with the rest of your body. If you would like more definition or a sleeker contour in certain areas of your body, if your skin elasticity is good. Liposuction removes fat but does not tighten skin. Now that we know when to consider liposuction, we are going to talk about who is a good candidate. In general, good candidates for a liposuction include healthy individuals who do not have a life-threatening illness or medical conditions that can impair healing, non-smokers, individuals with a positive outlook and a specific goal in mind for body contouring, individuals with a minimal amount of excess skin and good skin elasticity. Loss of skin elasticity with age can compromise lipoplasty results, but if your skin maintains elasticity, age alone is not a contradiction for liposuction surgery. Concentrated pockets of fat do not respond well to diet and exercise. So if you are bothered by excess fat deposits located anywhere on your body that don't respond to diet or exercise, liposuction may be right for you. If you're physically fit, no more than 20 pounds overweight, and your weight is stable, if you are planning to lose a significant amount of weight or even gain weight, for example, due to pregnancy, this is not the time to undergo liposuction. Also, keep in mind that liposuction does not remove cellulite and cannot tighten loose skin. Your surgeon will be able to recommend other procedures to improve those conditions. Now that we have a clear idea about the candidates and the requirements, let's talk a bit about the procedure itself. How is a liposuction procedure performed? For the liposuction surgery, very small incisions are made at the place from where the fat is to be removed, and then a narrow tube called cannula is inserted into a small incision nearby the target area. Next, this tube is attached to a strong vacuum, which is drawn back and forth within the excess fat in order to draw it out while keeping the blood vessels and nerves intact. Some liposuction procedures may require only local anesthesia and intravenous sedation limited to a specific area of your body. Other procedures may require general anesthesia, which induces a temporary state of unconsciousness. The surgical team will monitor your heart rate, blood pressure, and blood oxygen level throughout the procedure. If you are given local anesthesia and feel pain during the procedure, tell your surgeon. The medication or motions may need adjustment. The procedure may last up to several hours, usually takes between 1 and 4 hours, depending on the extent of fat removal. If you've had general anesthesia, you will wake in a recovery room. You'll typically spend at least a few hours in the hospital or clinic so that medical personnel can monitor your recovery. If you are in a hospital, you may stay overnight to make sure that you are not dehydrated or in shock from fluid loss. There is another question that always comes up at this point, and that is, what are the different types of liposuction? Tumescent liposuction. This is the most common type of liposuction. The surgeon injects a sterile solution, a mixture of salt water which aids fat removal, and an anesthetic, lidocaine, to relieve pain, and a drug, epinephrine, that causes the blood vessels to constrict into the area that's being treated. The fluid mixture causes the affected area to swell and stiffen. The surgeon then makes small cuts into your skin and inserts a thin tube called a cannula under your skin. The cannula is connected to a vacuum that suctions fat and fluids from your body. Your body fluid may be replenished through an intravenous line. Ultrasonic assisted liposuction, or UAL. This type of liposuction is sometimes used in conjunction with traditional liposuction. During UAL, the surgeon inserts a metal rod that emits ultrasonic energy under your skin. This ruptures the fat cell walls and breaks down the fat for easier removal. A new generation of UAL called Vaser-assisted liposuction uses a device that may improve skin contouring and reduce the chance of skin injuries. Vaser is an ultrasonic cannula with several grooves that evenly disperse the energy, improving fat disruption and removal. Another type of liposuction is laser-assisted liposuction, or LAL. This technique uses high-intensity laser light to break down fat for removal. During LAL, the surgeon inserts a laser fiber through a small incision in the skin and emulsifies fat deposits. The fat is then removed via a cannula. Next, power-assisted liposuction, or PAL. This type of liposuction uses a cannula that moves in a rapid back and forth motion. This vibration allows the surgeon to pull out tough fat more easily and faster. PAL may sometimes cause less pain and swelling and can allow the surgeon to remove fat with more precision. Your surgeon may select this technique if large volumes of fat need to be removed or if you have had a previous liposuction procedure. And finally, suction-assisted liposuction, or SAL. The most traditional form of liposuction draws fat out with a vacuum. And finally, we're going to talk about the recovery after a liposuction. It is vitally important that you follow all patient care instructions provided by your surgeon. This will include information about wearing compression garments, taking an antibiotic to reduce the risk of infection if prescribed, and the level of activity that is safe. Your surgeon will also provide detailed instructions about the normal symptoms you will experience and any potential signs of complications. It is important to realize that the amount of time it takes for recovery varies greatly among individuals. The first 2 weeks after a liposuction. The first few days after surgery, you should rest quietly. Elevate the affected body part if possible. Remember, you must not take aspirin or certain anti-inflammatory medications. You will most likely wear a post-surgical garment. If it is too tight, notify your surgeon. The first 48 hours after surgery, you will experience varying degrees of swelling and bruising. The swelling is maximal at 48 hours after surgery and mostly disappears within 2 or 3 weeks. But there may be slight residual swelling for up to 4 months. Bruising is normal and typically disappears within 7 to 10 days. Sutures, if placed, are usually removed 7 to 10 days after liposuction. Do not smoke after your liposuction surgery to prevent coughing and bleeding. Do not drink alcohol for 5 days after surgery or while you are taking pain medication. Avoid straining, bending over, and lifting during the early post-operative period. In many cases, you will be able to resume most of your normal activities within 10 days or less. Discomfort after liposuction is generally limited to soreness rather than pain. Pain medications are prescribed to lessen any discomfort during the first few days. How long it will be before you are able to return to work will depend on a number of factors, such as the type of job you do, how much of your body was treated, the area of liposuction, and how much of fat is reduced. However, patients usually are able to return to their work after 7 days. But to be on the safe side, one should take rest for at least 10 days. Iranian plastic surgeons highly recommend that you should avoid using airplane until 7 days after liposuction in Iran. The patient is required to keep the incisions clean by washing them with soap and water and showering daily. Application of ice packs, heating pads, and bandages is not allowed on the treated areas during the recovery stages. Weeks 2 to 6 after liposuction. It is important to ambulate as soon as possible after liposuction to discourage swelling and prevent blood clots in the legs. However, avoid strenuous exercise for 4 to 6 weeks because it can trigger unnecessary fluid retention in the treated areas. You should wait a minimum of 6 weeks before exposure to sun and heat, including sunbathing, because of the possibility of swelling. You will wear a compression garment over the treated areas for 4 to 6 weeks to control swelling and promote skin contraction. In general, liposuction recovery time frame depends on each person's body healing rate and body recovery speed. Now that we have a clear idea about the liposuction procedure, we are going to talk about the usual questions that come up for many of liposuction applicants. Number 1. What is the post-operative diet for a liposuction? If the patient has undergone the surgery with local anesthesia, he or she can resume their diet almost immediately. A well-balanced diet rich in nutrients, proteins, and carbohydrates is advised. Fruits and vegetables are a must. Lessening of sodium or salt in food after the procedure is advised to lessen edema or fluid buildup in the body. It is also important to stay hydrated. Therefore, the patient must drink plenty of water and stay off soft drinks. Number 2. How long will the results last? The results of liposuction surgery are technically permanent because the fat cells have been removed. However, your body shape and contour might be affected by weight gain, aging, pregnancy, family genes, and lifestyle factors. Number 3. What will my liposuction incisions and scars be like? Because liposuction incisions are small, the scars are also small. The amount or degree of scarring depends on the surgeon's technique and your genetic tendencies. Most lipoplasty scars fade and are barely perceptible over time. Visible scars are more likely when large liposuction cannulas are used and in patients who have darkly pigmented skin. Number 4. How much fat can I lose in a liposuction surgery? The doctors cannot remove more than 5 liters, which is roughly equivalent to 11 pounds of fat. Number 5. Is liposuction safe surgery? Liposuction is an elective cosmetic procedure that may have major risks. It's not a substitute for weight loss, and not everyone is a good candidate for it. Make sure you meet with a board-certified plastic surgeon and discuss the potential complications and risks before the surgery. Number 6. How soon can I get back to my country? Liposuction's first stage of recovery is 1 to 2 weeks, and after that you can easily get back to your country, and it's safe to think of 10 days of stay for the surgery recovery. We have tried to mention all the things you need to know about this surgery. Hope you have enjoyed listening to our podcast. For more information about the procedure, you can check out our website, iraniansurgery.com. Stay with us for more podcasts on iraniansurgery.com.